I think Andy ought to answer that.
Sure. So we can map out.
Repeat the question.
Oh yes, the question: what kind of physiological differences can you see in the brain of a person with depression or chronic depression versus a healthy subject?
And versus anxiety.
Oh, versus anxiety.
Yeah, those three things. If there is a distinction.
Okay. For depression, I can speak of depression. I'm not familiar with anxiety, but for depression, we have an limbic network. So we have several brain regions that are highly integrated, and they're involved in fight or flight responses, that sort of thing. And we can see distinct differences in how these brain regions are talking to each other. Well, let me start simpler. So early in the field, we were just looking to see how do brain activities independently of one another differ, and we could find regions like the amygdala, which is heavily involved in fear processing, which would be over or hyperactive to negative stimuli in patient and depressed patients relative to controls. And now we're looking more at the network. So we know what brain regions the amygdala is talking to. It's going upward to the prefrontal cortex, which is involved in a lot of social judgments and I guess social decision making, social conflict, and we're seeing that connection is actually weaker. So you have a lot of gas in the amygdala, not a lot of brakes up front. So that could be leading to spiraling out of control and having inappropriate responses in different social situations.
So can you say in general, how different is a normal brain from that of a person? Are we talking vast differences, or are you looking at nuances here and there?
Well, that's the thing. Our field is currently looking at statistical differences, so group differences, but we're trying to push the boundary and look at individuals and getting to the point where we can take an individual patient and predict treatment outcomes. So you can ask, would this person best respond to cognitive behavioral therapy or a pharmacological intervention or deep brain stimulation? So that's where we're going. In the field, we're getting there very quickly. There's a few preliminary studies out trying to map out individual differences in neurobiology and from that predict what kind of treatment might be ideal for a given patient.